Hi, my name is Rafael Bejar. I'm a physician scientist at UC San Diego at the Moores Cancer Center. The question of whether DNA methylation can predict response to hypomethylating agents is one that has been looked at for quite a long time. We understand that myelodysplastic syndromes are largely diseases of epigenetic dysregulation. The most frequently mutated genes in this disease involve changes to DNA methylation enzymes like DNA methyltransferase 3A and the enzyme TET2. And our therapies for MDS tend to be therapies that address the epigenetics of the disease. So our most commonly used agents, azacitidine and decitabine, target DNA methyltransferases and lead to hypomethylation. So it was thought that perhaps the methylation state of a patient's disease prior to treatment might be a predictor of whether or not they would ultimately respond to that therapy. And since most patients don't respond, just over 50% have no significant benefit from these agents, it's an important question to answer. Our study at ASH examined patients from a clinical trial of a novel agent, pevonedistat, in combination with a hypomethylating agent, azacitidine, and examined whether or not methylation states prior to treatment or just after therapy in cycle 2 could predict eventual response. And the answer was that there was a pattern that was observed in patients who ultimately did respond. That is, those patients that ultimately responded had greater degrees of demethylation or hypomethylation when tested in the middle of cycle 2 compared to those individuals who ultimately did not respond. Unfortunately, there was no significant difference in methylation states that predicted response when patients were tested prior to the initiation of therapy. However, since responses take several months to occur, in some cases over 3 or 4 cycles worth of treatment, knowing whether a patient is likely to respond in cycle 2 may provide the clinicians additional evidence that helps them decide on how to proceed with treatment.